Hello, this is Dr. Do again. This video is on alphabetic list problems. I think I have finished the problem started with letter H. There's some other conditions like a hernia disc or hemorrhage from internal organs damage. I think those content has been covered by previous videos. So I'm going to move on to the letter I. The first thing came to my mind is not a disease, but it's related, regulated diseases, which called, I'm going to talk about the insulin, because it's so common, everybody knew it, but there are a lot of things I think probably behind for what we know. Let me just bring up the any emergency situation associated with insulin. When insulin is low, probably not acute situation, because that when insulin is low, then glucose is high. The high glucose usually is not in short time, 1 day or 2 days. It's usually take a long time. So it's not an emergency unless you do not know suddenly the glucose build up, accumulated to the high level, either from type 1 or type 2 diabetes, cause this osmolarity or ketoacidosis, or osmolarity called high osmolarity caused the coma. But usually, on the other hand, if insulin is too high, that is the emergency situation, because that a high amount of insulin, either from the insulinoma, which is a tumor of those beta cells, I'm going to talk about details, or the exogenic insulin overdose. High insulin circulating the body is kind of dangerous because the glucose is low, called hypoglycemic. That could be long. Actually, if hypoglycemic not corrected in time, it could be very dangerous, life-threatening, or the brain loss function become permanent damage. So if that's the case, what kind of signs of this overproduce or overdose of insulin is shaking, feel altered mental status, feel stupor and couldn't tell date or orientations, and if you may or may not know you have this kind of problem. So if that's the case, and also associated with heart beating fast and diaphoresis, a lot of sweatings, feel shaking and weak. So if that's the case, if you know you have diabetes, you're taking insulin, then immediately take some candies, or if you do not know, then check it. Call the emergency as soon as possible and to check it and to make sure to correct this hypoglycemic caused by the either overdose of insulin or overproduction of the insulin. Any conditions associated with insulin, either high or low, you can manage at home, probably know, already know it. Diabetes or hypoglycemic, you cannot manage at home unless, like I said, you know it. You're experienced long-term diabetic patient, you know the insulin dose probably not adjusted according to your activities, your lifestyles, and you know it, then you just take a little candy or sugar, water or juice to correct it. Otherwise, it has to be managed by the medical professions under the guidance of physician. So having talked about this clinical associated with insulin, let's talk about the fundamental. Insulin is produced from the pancreas. We already know, I think I have talked about the pancreas many times, and I brought some, when I talk about the pancreatitis or pancreas, I mentioned some introduction about insulin. Basically, in the pancreas, there are individual millions of the islands wrapped by the pseudomembrane. It's not a membranous, but it's kind of isolated structure called islets. In these islets, there are alpha cells, beta cells, and delta cells. They produce different hormones, glucagon, insulin, and somatostatin. But the insulin is produced by the beta cells. Okay, it's a huge amount of the beta cell in the peripheral of the islets. And this insulin was synthesized as a small peptide, actually as a pre-pro form, so undergoing 2 times cleavage. First time pre-insulin was processed, become pro-insulin, and pro-insulin would further process in the body with secretion of insulin to decrease, to cut the C-peptide away from this pro-insulin, so then becomes insulin and a C-peptide. This is the clinical significance of this. If somebody had insulin high, then measure the C-peptide, can tell whether this is the high insulin from endogenous or exogenous. For example, if some professionals from working in the clinic, they probably sometimes injecting, but there's some old cases. It's not common, but could be possible. Or your patients come here with hypoglycemic sign, you do not know is it from the exogenous insulin injection or from the internal insulin production, then check this C-peptide, because this C-peptide should be equal to the insulin if that's from the endogenous production of insulin. So having said that, the production of insulin, what the insulin do, what does insulin do to our body? We know it, to decrease glucose. Insulin has the receptors located in the liver, in the muscle, in the adipose tissue, which are fat. So insulin binds these receptors through the cascade of mechanism inside of the cell. So these cells are taking the glucose to metabolize in the for example, in the fat adipose tissue. Those extra sugar will become the fat deposit. And in the muscles, those kind of sugar, extra sugar, will become glycogen as a storage. Also the same as liver, take that glucose from the glycogen to store. So this is the insulin secretion, the function. And the mechanism of this overproduction, or the cause of overproduction of insulin, like I said, either from, I think there's a disease called insulinoma, which the special, it's just a specific tumor, overgrowth of beta cells, so then secrete a huge amount of insulin and associated with hypoglycemic. As I mentioned earlier, could be very dangerous. Could be, usually it's not 1 day or 2 days, gradually until it's kind of subtle. You do not know until one point the insulin is really high, develop those symptoms like shaking and weak and altered mental status, etc. So what about if insulin not enough? You already know it. If insulin is not enough, then that's the condition called diabetes mellitus, which means the full name of diabetes mellitus. So then, which means the glucose, the insulin, either from type 1 or type 2. Type 1 is the pancreas cannot produce enough insulin. I already talked about that. And type 2 is those adipose tissue or the muscles or the liver do not respond to the insulin. So the glucose cannot be taken. So those extra glucose just circulate in the blood and cause a lot of damage to the end organs like kidney, retina, and brain. So that's why the hypoglycemic diabetic mellitus has a serious complications. I think I have mentioned many times before. I'm not going to talk it again. So this is about this video, the video of today about insulin, just from the basic fundamental, how the insulin is secreted, where is it produced, and how it functions, and in terms of regulated blood, and what kind of signs you're looking for, hypoglycemic, which is dangerous, and hyperglycemic, which is diabetes or pre-diabetic situation. I already talked in the previous video. So I'm going to stop here. Thank you for watching. I will see you next time.